Hello, everyone. So, today we're going to be talking about ethics, and more specifically, a specific ethics case study that gives us a scenario. And we're going to dig deeper into the rights and wrongs, immoral versus moral, and just more questions that a lot of people might not think to ask. So, the study that we're going with today is about a girl who goes to the doctor with her mom and finds out that she has an STD. Where they live, the daughter can get treated without the information being relayed to the parental figures. The daughter begs the doctor not to tell her mother, and she doesn't know that she's sexually active and she really would not be happy with her. The mother asks the doctor what is wrong and why certain medications are being prescribed. She claims that she cares very deeply about her daughter and wants what's best for her. So, should the doctor disclose it to the mother? Some might say it's clear what the right decision is. Just don't tell the mother. But let's dig a little deeper into that. Let's say the doctor decides to not tell the mother. In doing so, he's protecting the daughter's privacy. She can now get treated without getting in trouble with her mother. In some cases, the mother may be okay with the answer the doctor gave, but let's say she's not. Now there's a potential of a big scene being caused. She may scream and yell and cuss at the doctor and others in the room. She may request to talk to someone higher up and even threaten to get lawyers involved. And especially in modern day, that's a very big possibility. People can get out of hand a lot, and it's something that people have to be prepared for. Once the mother and daughter get home, the daughter could get in trouble if she doesn't tell her mother what's wrong. She could get grounded or potentially hurt. She might be forced to tell her mother what she was diagnosed with, even though it was strongly against her wishes. The doctor did his duties of treating his patient and giving her privacy, but were the consequences worth it? This is motive versus consequence. The doctor had a good motive behind protecting his patient, but he received very bad consequences. If he had known what the result would have been, would he have done the same thing? Would anyone do the same thing if they knew what the consequences were prior? If you were the doctor, would you have done anything differently? I know I wouldn't have. As a doctor, it's your job to focus on what is best for the patient. If she requested her diagnosis be kept a secret, it is my duty to do so, even though the consequence is undesirable. Now let's say the doctor decides to tell the mother. The mother is now angry at her daughter for being sexually active, not using protection, etc. She's yelling at her daughter. Or maybe she's calm at the moment, but when they get home, the daughter's going to be in a lot of trouble. She'll feel embarrassed and alone. She may be receiving treatment, but now she feels like her mom will look at her differently, maybe even tell others what her diagnosis was. She's worried and scared. She no longer has any trust in that doctor. She feels he betrayed him. While the consequence may not have affected the doctor, it certainly affected the daughter. The doctor cannot control what happens once the mother and daughter leave the hospital. Why should he worry about them when making his decision? Should he have considered the consequences for the daughter? If you were the doctor, which route would you have taken? Me personally, I would have stuck with the first option because yes, you're getting yelled at, you're being threatened, and the situation could become bigger. But in the end, you are protecting the privacy of the patient who you are treating. And it may come with you being yelled and screamed at or you being judged for trying to protect her. But in the end, I feel that that is your job. Not everyone's going to agree with that, though. Some people may say that a doctor's duty is to treat and that's it, that he shouldn't worry about how it would affect the daughter or the mother or their relationship, and that he should just tell the mother if she asks, because as her guardian and parent, she has a right to know these things about her daughter, even if she wants to keep it a secret. And teenagers can be very sneaky and can keep things from their parents, so they may think that it would be best to tell the mother so that way she knows and she's aware. And while, yes, she may not have such a big reaction, she could be very supportive and, want the daughter to get her treatment and then teach her about protection and other things and making sure that she's comfortable enough. But you just also have to think that not everybody is going to be as understanding as that, especially older generations who had very different mindsets about this stuff a while ago. They're going to keep that same mindset and they may not be happy to hear that their child is sexually active. I believe that both sides have positives and negatives, and sometimes you have to take motive and consequence and either put them together or weigh the pros and cons of which one would outweigh the other and which one you should be focusing on when making an ethical decision. Nothing in the world is just black and white, and there are a ton of gray areas, and I am a firm believer in that. There is nothing that is purely right nor purely wrong. Everything has an in-between and has two sides and has iffy areas where, some people may not agree and others may agree. Neither opinion is right nor wrong. That's the funny thing about ethics. There can be more than one right side. Each person has an ethical system and how they judge right and wrong. What does your ethical system include?